Today at the Chemotherapy Foundation Symposium, I'm going to be talking about how we can use immunotherapies for patients with colorectal cancer. We've seen very exciting data that patients with microsatellite unstable colorectal cancer, these are patients that have a higher rate of mutations than others, are very responsive to immunotherapies. And in fact, we've seen FDA approvals of pembrolizumab for patients with microsatellite unstable cancers, as well as nivolumab for microsatellite unstable colorectal cancers recently, just showing what the benefit of these agents can be for patients with colorectal cancer. However, 95% of patients with metastatic colorectal cancer are not microsatellite unstable. So what do we do for these patients who are microsatellite stable? We know that they tend to not be very responsive to single agent immunotherapies. So what can we do to potentially make them responsive? And so we've seen some preliminary work showing that combinations of immunotherapies and other agents may get the immune system excited within these patients with microsatellite stable colon cancer to cause them to respond. So we've seen some initial data with the combination of PD-L1 inhibitor atezolizumab with MEK inhibitor cobimetinib, some very interesting preliminary data which led into a randomized phase 3 global study, which has completed accrual, and hopefully we'll see some data from this study in the next year. And then we've also seen drugs like bispecific antibodies. There was data presented at ASCO this past year of a drug called CEA-TCB, which binds both to the CEA in the tumor and the CD3 receptors on the T cells to try to bring the T cells into proximity with the tumor. And we saw responses both with the single agent bispecific antibody as well as this antibody in combination with the atezolizumab. And so this agent is also going on to further studies for patients with colorectal cancer. There's a lot of other combinations that are also currently being looked at, but these two are probably the furthest ahead. But what we're seeing now is there's promise for patients with metastatic colorectal cancer that is microsatellite stable and the potential for being able to respond to immunotherapies.